We have been debating universal health care for the past 97 years, and yet we still don't have any health care system. Have you ever wondered how other countries do this? Stay tuned for Australian healthcare.
Welcome to The Better Part, a program by and for seniors and devoted to exploring the many facets of those better years of our lives. The name of our program is inspired by a quotation from Robert Browning. "Grow old along with me, the best is yet to be, the last of life for which the first was made."
I'm Nick Szabo, your host. My guest today is Dr. Carolyn Tuchek-Szabo from Australia to tell us how Australian healthcare system works. Carolyn, tell us where you live in Australia.
I live in a city called Melbourne and in the suburb of Hawthorn, so that's in the state of Victoria, which is down the southern part of Australia.
But you have also lived in the United States.
Yes, I have. I lived in New York for 2 years and I lived here in California for 6 years.
The World Health Organization ranks different countries for the quality of healthcare.
Mm-hmm.
The healthcare in the United States is number 37.
Mm-hmm.
Australia does quite a bit better. But what is remarkable about Australia is that while we in the United States have the highest per capita healthcare cost, Australia has 1/3 of those costs. So that's an interesting thing. So maybe you can tell us how it operates. When you go to a doctor, how does it work in Australia?
Okay, so firstly what I think your viewers would be interested to know is that we have a national health system. That means every Australian citizen has access to medical care, and the system is called Medicare. So everybody is given a card, a small green card, and you have one per family as long as your family members are all Australian citizens. And each time you go to your local doctor, you would present this card. And some doctors will say, all right, we're charging the same amount as the government will give back to me. So you do not get a bill, it's basically free. If you choose to go to another doctor that may charge more than what the government gives back under Medicare, you may choose to do that because they're local and you like them for some particular reason, and then the Medicare rebate will come back to you, but you will be out of pocket for maybe $10 or $15 if you choose to do it that way. All local doctors are under the Medicare system. If you want to see a specialist, you must get a referral from your local doctor, and you may use also the specialist under the public system, or you can have private health insurance and choose a specialist of your own liking.
Now, Carolyn, how much would it cost for me to go to see an Australian doctor?
All right, well, that normally it would cost you probably about $40 for a 45-minute consultation, but that would be covered by the government, so you wouldn't pay anything. I choose to go to a family doctor that charges $60. So when I go there, Medicare pays for $40 and I must pay for $20.
And he's free to charge you as much as he wants
yes,
to, but you don't have to take him.
That's exactly right. They're allowed to charge whatever they want, but obviously at a certain price they outprice themselves. But certainly in more affluent areas where the cost of all the overheads and rental of property and so on is more expensive, they tend to charge a little bit more. So, yeah.
Now, you also have private insurance in addition to that.
Yes.
How does that work?
I think most people that have a good standard of living would have private health insurance, and the reason for that is that private health insurance kicks in when you go into a hospital situation. So all of your hospital stay is free, all of your treatment is free, all your surgical needs are free. So people like to have that security if they have children or sickly relatives, that's all free. You also get to choose the specialist who works with you, the surgeon or the cancer doctor or whatever. If you're under the public system, you will still get treated in a hospital, but you're basically given whoever's available. And sometimes that's teaching staff, not always fully certified staff of your choosing.
But for the ordinary office calls, you get to choose your own doctor.
Yes.
Okay, so it's only if you have a hospital, then you have to maybe assign a doctor if you don't have private health insurance.
Well, some of the specialists, if you want to go and see a dermatologist or something like that, they may not take you as a public patient if their fees are quite high, unless you can pay on the spot. They do tend to, there's a hierarchy with the specialist doctors, and there's the basic ones that a lot of the public patients see, and then there's some that are really quite pricey that if you have just cash to burn or private health insurance, you would see them.
You told me though that even the best doctors practice in government hospitals.
Yes, that's true. But the best doctors will go maybe 2 days a week to the public hospitals because they really feel this, it's not a philanthropic feeling that they want to give back to the system and also make sure that the general public have access to great care. So if you happen to get lucky on one of those times, you can have the top surgeon operating on you if that falls on his rotation for that month at that hospital.
You had a rather serious operation, and you used their private health insurance.
Yes, I did.
How much does it cost to have private health insurance?
Well, it depends if you're a single person, a couple, or you have children. Typical for a singles coverage, it would cost about $70 a month, Australian. We have a family plan, that's 3 children, 2 adults, and that's about $260 a month. But that includes a lot of extras, so that includes ambulance care, we have some dental coverage, we have some physiotherapy coverages, and so on.
Now, how about the x-rays and laboratory work? Would that be included in your regular hospital bill paid by the insurance, the government insurance?
Yeah, if you have those things done in the hospital, then it would be covered by your private health insurance. If you need to go and have an x-ray, just from your local doctor says go and have your arm x-rayed, that's still through Medicare, and you still pay a certain amount, and there's a small gap that you have to be.
On pregnancies, for instance, if you don't have private health insurance, you would use a government hospital.
That's exactly right. You would go to your local doctor and they would assign you an obstetrician, and you would be seen through the public system at a hospital.
I see.
You still get to stay the 5 days, like the private patients.
Yes, yes.
They don't say you're only here for 1 day. As a public patient, you still stay the same.
Well, how long did your children were born in the United States? How long were you?
Well, for the first one, Sebastian, I was in hospital, I think, 36 hours. It was very fast. But for the girls, I think Clinton brought in 48 plus days, so I was 2.5 days to 3 days with them.
So the Australian healthcare is more generous.
Well, that, and they also believe in educating people while they have them. So the more that they educate the mothers in hospital, the less likely they're going to come back with problems, which is a burden on the health system. So they're proactively trying to educate people so they're not in hospital or having to go to the doctor with problems that could have been solved in hospital.
I see. How about prescriptions? How does that work?
Well, again, prescriptions come under the government rebate system. So when a doctor gives you a prescription, you go to the pharmacy, you show them your Medicare card, and then you have a choice of either the brand or the generic product. I never know how much it would cost if I didn't have the government rebate because I'm under the Medicare system, but I've never paid more than $20 for a prescription.
You know, when we were visiting you in Australia, I bought a bunch of medicine because it's much more. It turns out that it costs same medicine as sold in the United States. It costs less than half in Australia. And of course you don't even pay that much.
No, no.
I understand also that if you are retired, you have a special discount.
Yes, there's an extra seniors discount for that. And then also, you know, there's some medications that the government thinks everyone should have access to, and that's the public benefit scheme. So there's a new fantastic, like for example, the new drug Taxol for breast cancer.
Yeah.
You used to have to pay for that, but now that's been brought under the benefit scheme, so everyone who's an Australian citizen can have access to that drug at the government rate. So they incorporate new drugs into the system as they think it can benefit the vast majority of Australians.
Yeah, you have a relative who's a pharmacist, and he told me that rather than having the pharmaceutical companies send out these salesmen, that the Australian system is that a bunch of a committee of medical professors educate the doctors there, so they do not get a biased system. And it has also the interesting thing that it costs. There's a significant marketing cost in the United States of sending these salesmen out to, frankly, pester the doctors, and apparently that does not happen in Australia.
No, it doesn't. I'm very familiar with the pharmaceutical and biotech industry as I work in it myself.
Yes.
And I know that we believe that the medical profession are the ones that can better decide which drugs should be available to the public. And they don't want the spin from the pharmaceutical companies selling them the results of a clinical trial. They want to make the decisions themselves. And like you said, they really don't want to be bothered with a marketing plan. They want to they decide these things based on the medical facts themselves and under a committee that is given that responsibility.
Also, as I understand that in Australia it's not legal to have on television advertisement of prescription medicine.
No, we don't do that.
Yeah. It turns out that I read up on it, and in there are only 2 countries in the world that allow that, like in the United States. It's the United States, and in addition to that, it's New Zealand.
Well,
it's kind of interesting why it would be New Zealand. And one of the contentions here is the fact that people are apprehensive of universal health care because they feel that they will lose the ability to choose their doctor. But that's not you can choose your doctor in Australia, except for the fact that in a hospital, if you don't have private health insurance, then you may be getting the regular hospital doctors. Is that right?
Yes, I think that the difference between the American system and our system is that we rely heavily on our local general practitioners. So everybody must see that doctor first before they see a specialist. So you cannot go directly to a dermatologist, a heart specialist. So you rely on that local doctor. And yes, you have the right to choose which local doctor you go to. Some, like I said, will charge more than the Medicare rebate, but if you want to pay that extra $15, you can. So it is true, it's only really when you get to the hospital that if you need surgery or some kind of treatment, they will give you who's available at that time, who's responsible, unless you have private health insurance, and then you would choose your own doctor.
Now, do you happen to know how much you have to pay in the hospital for a pregnancy? Assuming you don't have private health insurance.
Well, I'm just trying to think about that. It might cost something like maybe $3,000 to $5,000 maybe for the stay and for the delivery suite and so on. I'm not too sure. My sister was a midwife, and those were maybe the costs she gave me somewhat 10 years ago, but it's in that order, I think, around $3,000 to $5,000.
But if you have private health insurance,
it would be nothing.
It would be nothing.
No, the stay comes under your health insurance. But I should say that you must be under a health insurance cover for at least a year before you can gain those hospital benefits. You can't find out that you're very sick and then want to get in 3 months' time into a hospital. There is a 12-month layoff period, except if you were unaware of your medical condition when you join them. So.
Yeah.
So you must be with them for a year before you can use them for a pregnancy stay.
You are familiar with the education required for to be a doctor there?
Yes.
Can you tell us how?
Sure. When you finish high school, you are selected into several medical schools. There you will undergo general training for 6 years at the university. After you've done those 6 years, you pass final exams, and then you must spend 2 years in a hospital doing various rotations in the different areas. Once you've done those 2 years, you are licensed to practice. However, everyone must specialize, even the general practitioners. So you would tend after that to go and then start specializing in a part of a hospital or a general practitioner's center and do further training. So for a general practitioner, you would spend another 2 to 3 years training. If you want to become a surgeon, you still have another probably 5 to 10 years of training and going through all the various levels of seniorship until you are ultimately
now,
at your specialty.
Do you have to pay tuition at the university?
You didn't used to, but now you do. But even so, it's fairly minimal. I think for a doctor, I'm trying to think how much you would spend a year. It's maybe $500 a year. I'm trying to think how much it costs for the medical degree now. It used to be $100 a year. But it might be 500, I'm not quite sure.
Well, how do people finance that?
You can take out a loan from the government. It's tax-free. And so you take out the loan for the whole time you're there, and then once you reach a certain threshold of earning capacity, they start asking you to pay it back. There are incentives if you can pay it upfront. From year to year, that you don't have to pay so much, they give you a discount, but you can go right through medical school without paying a cent, and then once you start earning money, they start to take a percentage out of your salary, and they do it at a very slow incremental stage. So it's not like you start earning and suddenly all your salary's gone. They do take their time and realize you have to live as well, and so then you just gradually pay it off.
You know, one of the problems is in the United States that for a surgeon, for instance, by the time he is ready to practice, he may have $400,000 in debt. In Australia, you do not have to have a 4-year undergraduate degree before you go to medical school. So as a result, people have a longer, useful professional lives. I think that makes a significant difference. Also, you have more doctors per person in Australia than we have here, and that also contributes to the higher prices, because you have some competition in the medical field. You can go to one doctor or another. If you raise your fees too much, then you will lose patients, I think.
That's correct.
Well, I think that's a very useful thing. I think we need many more medical schools here. We are importing a lot of doctors, and it doesn't seem to be working too well. Now, do you make extensive use of nurses? We have what they call nurse practitioners here. A nurse practitioner, for instance, can write prescriptions. Do you have that in Australia?
Nurses are not authorized to write prescriptions unless in certain palliative care circumstances where they are given direct orders by a doctor over the phone. But we do use the nursing staff in a system called district nursing. That's a group of nurses that will go around to the community and visit the elderly or people who are at home who need help. and checking up on people who've come home from hospital who cannot get to the doctor themselves.
And how do you take care of what we call here long-term care? For instance, if somebody has Alzheimer's disease.
Well, we have public and private nursing homes. Obviously, if you have, you can afford it, you can go into a private nursing home, which is just probably, it's a nicer standard of living for the inpatient. But that doesn't mean if you cannot afford it. There are public nursing homes, and it's really just when a bed becomes available that your local doctor will organise to have you transferred to the local public nursing home.
So they must be quite expensive, though, the private ones, I presume.
I think the private ones just tend to have more, sometimes they have more nursing staff available, maybe the doctors come more often, sometimes the rooms are just nicer. I mean, that doesn't mean that the public ones are awful. It just means that, like everything, a public hospital is very busy and the doctor may come around once or twice a day, and in private they have less patients, so they have more time. So that's just a ratio scenario, really.
And your mother, in fact, worked at one of these...
She did. She was the matron of a nursing home, and it ran really, really well. They had the pharmacists come out there and do all the medications. They would have all the doctors come out there and visit all the patients, and they had full-time multiple nursing staff and stations.
What is there being done in preventive care?
I think, like I said, I think we're all about education, and that starts with your local doctor. So in terms of preventing breast cancer, they're very proactive in having women undergo mammograms at a certain age, and that's for free. That comes under the government system. They want men to have tests for prostate cancer levels. They will promote when women have children, you don't go to a pediatrician, you all come to a local doctor, and they try to educate you on how to deal with the fever, how to deal with these things so you don't end up at the emergency room. I think it's all about education, and it starts with the local doctor. And then, like I said, when you're in hospital, they try to teach you how to look after yourself at home, or things to look out for if you have problems. They give seminars. There are always seminars available on diabetes or, like you said, Alzheimer's. When you go to the local doctor, there's a big pin board, and they ask, do you have a relative who has this? Do you need to know about vaccinations? They try to run educational programs all the time so that there is a preventative role rather than having to treat all the time. You try and prevent that mass of people coming to the medical system.
In fact, you don't have a pediatrician for the children, do you?
No, only if there's an issue. If you have a problem with your child and you go to the hospital, you will see a pediatric emergency doctor. If you have to have surgery, obviously it's a pediatric surgeon. But when your baby comes home and you're just having the general checkups, there is an early childhood development centre, and there are nurses trained to give immunisation injections and teach you about young babies. But you can also go to the local doctor and have that done as well.
Alex, our son, and your husband, he broke a leg skiing.
Yes, he did.
Now, how was that handled? He broke it here in the United States.
He did break it here, and basically we had travel insurance, because in Australia your private health insurance does not cover you outside of Australia. So we took out travel insurance, which was only cost us $250 for 3 weeks for the whole family. And that was lucky, because he ended up at the Tahoe emergency room, and that little visit cost about $4,000. But we didn't pay it because the travel insurance covered it.
Now, how about eyeglasses and so on?
Well, it depends on your private health insurance. And if you're a senior. If you have a senior, there are certain discounts under the public system. If you're not a senior, but you have private health insurance and you choose that extra on your plan, like I have that on our plan, then if you go and you can have an eye exam for nothing. And they will also give you partially the amount of the prescriptive lenses and the frames back as well. If you don't have private health insurance, you can still have eye testing done. You just have to go to certain places which do that under that system.
And does that cost money?
No, you can have your eyes tested for.
It is for
Yeah.
free.
Yeah,
It's part of the plan,
yeah, exactly.
the government plan.
Yeah. Hmm.
How about hearing aid and things like that?
I wouldn't know about hearing aids yet, Nick. I assume it's a similar thing. I mean, we have a Cochlear Institute, and I know they're doing wonderful things with implants. So I think different hearing aids at different levels. I know that somebody who had hearing aids, they're quite expensive. They're $3,000 or so to have them put in, and that's under the public system. So some, depending on the level of, you know, I don't know what level you need. Some are quite expensive.
But as I understand, retired people get the special rates
Yes.
on everything.
Yeah. Over 65.
Yes, over 65. And medication costs, the co-payment is only about $5 if you're retired. And
Yes, yes.
So it's much lower than that.
And for private health insurance, I forgot to mention, you get a rebate back from the government for taking out private health insurance. So you get 30% back of your annual costing. If you're a senior, you get 35% back. So they try to, you know, give you a discount there.
Can I move to Australia?
Yeah, we'll have you anytime,
Well,
Nick.
Thank you, Carolyn.
Okay,
I
you're welcome,
appreciate
Nick.
it. Wonderful.
It was nice to speak to you.
Waltzing Matilda is a song about an Australian hobo, I guess you'd call him. He wanders through the bushland of Australia and he takes all his meagre belongings wrapped up in an old blanket, which is strung across his shoulders with an old piece of twine. And this is called his swag, hence the name Swagman. Now, affectionately or otherwise, he refers to this swag as Matilda. It's like his only companion, and as he wanders through the bush tracks, he finds himself talking to it as if it's a real person. So the term Waltzing Matilda has nothing to do with dancing at all. It means, in fact, carrying this thing on your back through the long, lonely stretches of the Australian bush.
Thank you for joining us. We hope that you have found today's program both informative and interesting. If you would like to suggest a topic or a guest for The Better Part, you can always reach us at the Cupertino Senior Center. The number there is 408-777-3150. You can learn more about us and order a copy of this program or one of the many programs that we've done by visiting our website. The website address is www.thebetterpart.com. The Better Part has many of its programs available through the Santa Clara County Library System. And The Better Part has selected programs also on YouTube. Thanks again for watching. See you next week.